Here is a scenario of a pregnant woman at 32 weeks.
Hi, good morning. How may I help you?
I have an appointment for today.
Can I have your name, please?
My name is Arian Gravida, and here's my health card.
So, Ariane, Gravida 634222461. Okay. Here's your health card.
Thank you.
And just proceed to the examination room. Just follow the hallway.
Thank you.
You're welcome.
Hi, good morning, Mrs. Gravida. How are you?
I'm good.
Good.
Thank you.
So I'm Ria, and I'll be your nurse for today. Okay? Can you tell me your last name for me and your birthday, please?
My last name is Gravida. Sorry. It's Gravida. My birthday is May 20, 1990.
Thank you. Okay. Have you been told about your estimated delivery date?
My doctor said it's gonna be August 11, 2016.
Oh, okay. Okay. So now what you do, I have this cup. I'll give it to you, and then just so you resample just the last time you did, okay? And then when you come back, I will measure your weight and also the fundal height.
Okay, sounds good.
Yeah, perfect.
Thank you.
How are you here? Do you have any other concerns, Mrs. Gravida?
Yes, I do. When I was lying down and while you're measuring my tummy, I'm having shortness of breath, and I always feel that every time I'm lying down.
Okay, so when you say shortness of breath, what do you feel?
It is like I'm out of breath. It's hard for me to take a deep breath.
Okay. Do you have any idea why you're experiencing this? Do you have any history of heart disease?
I really don't know. All I know is I don't have any history of asthma or heart disease.
Okay, so when you're experiencing shortness of breath, do you also experience any cough?
No.
Okay, alright. Any fever?
Oh, no fever.
Okay. How about like severe cramps?
No.
History of heart disease and asthma may contribute to the patient's discomfort. As well, cough and fever may indicate respiratory problems, such as lower respiratory infections. Respiratory infections affect breathing. Severe leg cramps may indicate deep vein thrombosis. This is caused by poor peripheral circulation. These associated factors may present a problem for the patient and the fetus, so it is important to report these to your healthcare provider. Another thing the nurse did not mention is the effects of hormonal changes in respirations. When pregnant, your progesterone levels increase. An increase in progesterone also contributes to an increase in CO2 levels. Your body will try to expel the excess CO2, which then leaves you short of breath.
Okay. When do you experience shortness of breath?
Usually when I'm lying down, sometimes after a meal.
Okay, so at this stage of your pregnancy, you already know that you can already see that your baby is fully grown, right? So your uterus is expanding and crowding other organs into your lungs, which makes it, that's why you're experiencing shortness of breath.
Okay.
And it prevents full contraction of the diaphragm as well.
Here is a diaphragm of a normal respiration. In pregnant women, the diaphragm do not have room for a complete contraction, resulting in shortness of breath.
Don't worry. Even if you're experiencing shortness of breath, your baby is still getting adequate amounts of what it needs, right? Okay.
Oh, so that's what's happening. So, is there any way to avoid experiencing that?
Yeah, absolutely. There are many strategies to manage it. Natural ones, actually. I'll show you. Okay.
First, remember to avoid the following: overeating, smoking, wearing tight clothing, and doing any strenuous exercises. All of these may cause shortness of breath. Next, we will demonstrate a few non-pharmacological strategies to relieve your discomfort. Sit upright. This gives your diaphragm a little more room to expand and contract. Stretch your arms overhead and take deep breaths. Or swing your arm in circular motion. These light exercises facilitate chest expansion. Laying in lateral recumbent position with extra pillows also relieves shortness of breath. This helps keep the pressure off of the patient's vena cava, which helps facilitate blood return to the heart and increases tissue perfusion and oxygenation. Decrease in tissue perfusion may result in cyanosis. Cyanosis presents as a bluish tinge around the lips and the nail bed.
That's good to know. So the next time that I'm going to have shortness of breath, so all I have to do is just sit upright, sleep on elevated pillow, also avoid strenuous activities and eating lots of food.
Yeah.
Yeah, and some exercises like stretching
Yeah.
your arms over the head.
Yeah, good. So, and if none of this seem to work, seek medical attention, okay? Otherwise, Ms. Rabida, if you don't have any more further questions, we'll see you again on your next appointment.
Okay.
And have a great day and have a lot of rest.
Thank you
All
so
right,
much.
thank you so much. Thanks for visiting. Okay. Oh, you can take this pamphlet home and read it on your, free time. Okay.
Okay, thank
All
you
right.
so much.
I'll leave you in the door. Awesome. Thank you.
If these strategies do not relieve your discomfort, you should see your healthcare provider, as there may be underlying problems that need to be addressed. Thank you for watching our video.